Hi, have you just come from A&E? Okay, no worries. If you just want to take a seat, that's great. And how can I help you today? What's the situation? Oh, okay, you've had a bump to the head. Right. Okay. So what we can do today is we can do a cranial nerve exam. This is just going to make sure that everything is okay with you today. Okay. So let me just ask you a few questions first. So what's your full name, please? And your address? And your date of birth, please? Okay. And could you just tell me, are you on any current medication that I would need to know about? Okay. So I'm just going to ask you a few questions just to do with how you're feeling at the moment. So how is your vision on a scale of 1 to 10? 10 being the best. Okay. And how is the pain at the moment on a scale of 1 to 10? What do you say? 10 being the worst. Right. No problem. Okay. And do you feel dizzy or sick at the moment? So the reason that I just asked this question is that throughout this exam, if your vision starts to blur, please let me know. If you feel dizzy or sick suddenly, please let me know as well. And also if you feel an intense amount of pain, even a little bit, just let me know. If it increases, just keep me updated, okay? Perfect, all right. So if you just give me 1 second, I'm just gonna put my gloves on. All sorted, okay. So what I'm going to do is firstly, I just want to check if there's any swelling on your eyes, around your face, all around basically. So I'm just going to give you a little feel with my gloves. Is that okay? Perfect. Okay, start with the top of your head. Right, okay. Coming around your face. So your chin. There's no lumps there. Okay. Right. And now I'm just going to do the front of your face. Okay, starting with around your eyes. Any pain there? No. Just on the bridge of your nose. Any pain? Okay. Alright, so that's absolutely fine. There's no swelling, there's no bumps or anything like that. But what I do want to do is just go through a few tests with you today just to make sure that everything's okay. Alright? Starting with your eyes. So all I want to check is that there's no redness inside the eyes. Just have a little look around and then also see if your pupils are dilating. And then I will do a few vision tests just to make sure that your vision isn't blurry. Starting off just with a bright light, if you could just look at my nose, please. Thank you so much. Okay, so I'm just going to shine this light into your eyes. Okay. The other side. If you just want to keep looking at my nose, please, thank you. How does that feel when the lights go in your eyes? Are you feeling an amount of sensitivity? Any pain there? No. Right. You just keep looking at my nose, please. Thank you so much. Great, okay. And then if you just want to follow my light wherever it goes, please try and not move your head. It's just moving your eyes wherever the light goes, okay? done, you're doing brilliant. Well done. Keep going. Keep going. All the way back and all the way in. All the way back. All the way in. And one more time. One more time. Yeah, fantastic. Well done. Okay, so I'm just going to do a cover test. Okay, this is just with my little kitty cat here. If you could just keep looking at my nose, just straight forward, please. Okay, so. Great, and the other eye. Amazing. Let me just use my light again. Okay, so I'm just going to cover one eye and then shine the light in the other. Okay. And the other eye now. Okay. Just keep looking forward for me, that would be great. Wonderful, well done. Okay. So what I'm going to do now is I just want to do some colour tests. Okay, this is part of the vision test. Okay, just going to put some colours in front of you and all you have to do is just let me know what you can see. It's very simple. Okay, perfect. This one. Yes. And this one. Yeah. And this one. Yes. And that one. Okay. And that one. Yeah, she's trying to trick you. Okay. This one. Yeah, amazing. Okay. And just one more colour test. So, actually, use a blank piece of paper. Okay, and this one. Yes. And this one. And this is a little harder to see, I know. Yes, well done. Next one. Well done. And the final one. Well done. Amazing. Okay. So this is a little trickier now. Okay, so I have a black dot here. Okay, and what I want you to do is just tell me if you can see a colour behind the black dot. Okay, so like I said, just focus because this is a little harder. Can you see the colour behind the black dot? Amazing, well done. Okay, and the next one. Keep focusing. Yes, amazing. Next one. Focus. What colour is that? Behind the black dot. Well done. Okay, and the last one. Focusing. And what's that behind the black dot? Well done. I'm just going to make some notes now. Won't be a second. Okay, now I'm going to do a hearing test just so I can see what your hearing is like, okay? Okay, so this is going to make a noise. I'm going to put it to each ear and you're going to tell me when the noise stops. It's a frequency noise, so it might sound a little bit strange. Okay. Can you hear that? Let me do it again. Sounds like a buzzing noise. Yeah, can you hear that? Just one more time. Tell me when it stops, please. Now? Okay, thank you. Also, I've got a little snow globe with me here. Okay, so I just want you to let me know if you hear the water. Okay, let me just put it to your ear. You can hear that? Okay, other ear. Okay. Perfect. Okay, so just want to make some noises with my hands. Okay, to your ear. Can you hear that? Yeah, other ear. Perfect, okay. So now I'm just going to whisper some numbers in your ear and you're going to repeat what you've heard, okay? Fine with this ear here, okay? 21. 21. Yes, okay, other ear now. 102. 102. Perfect. Okay, this one is 205. 205. Perfect, okay, other ear now. 352. 352. Amazing. Well, you've done really well on the hearing test. But let me just jot down a few notes, okay? Perfect. So now I actually just want to measure your face, okay? And this is because I want to measure your face now and then at the end of this exam to see if there's any swelling, okay? So if the measurements go up, I know that there's been swelling on your face, okay? That's why we do this. So we just put this here. Okay, I'm just going to make a few dots. Okay, so that one and this one over here. Just make sure that's correct. Yep, okay, one here. One over here and one here. Just check those again. Just check. Let me just check. Yeah. perfect now. That's perfect. Okay, so like I said, what we'll do at the end of the exam is we'll just compare these dots to your face, and if they've moved, then we know that there's been swelling. Okay, so now I want to make sure that all your nerves are working correctly. Okay, so what this includes is my little hammer here. Okay, so if you just want to give me your arm, just pop it on my hand, just rest it on my hand. Okay, yeah. Alright, so if you can just close your eyes, just close your eyes, yeah. Okay, so I'm just going to slightly dab you with the hammer, and you're going to tell me if you feel it. Okay, close your eyes. Yeah. Perfect. Okay. Brilliant. And if you just want to focus on the hammer for me, so focus on the tip if you can, and we will see how your eyes are reacting to something coming really close to your face. Okay, so it's okay to react naturally. Okay, so I'm not going to hit you, don't worry, I'm not going to touch your face. Keep focusing. When something comes close to your face, you naturally react, and that's all working just fine. All your nerves are working fine in your face. Okay, something else I want to do. So just want to check your heart. So, pop these in. Now, all I want you to do, sit still and relax. Just relax, but keep really still for me, okay? So, this is quite cold, okay? So, I'm just going to put it on your chest and listen, okay? Breathe in and out, okay? Breathe in. One more time. Breathe in and breathe out. Okay, so now you don't need to do any breathing exercises, just breathe as you normally would, and I will listen to your heartbeat. Yeah, perfect. Okay, all working correct. No irregular heartbeat, which is very good. Okay, so next, if you just want to give me your arm again, okay. Just put your arm out for me, please. Okay. Now I'm just going to wrap this around your arm. Okay. It might give a little bit of pressure, and what that does is it just gives me your reading to your blood pressure on your arm. Okay, so wrap that around. Is that comfortable? Okay. So I've just got my manual measurement here, and I've just got my pump. Now, if I just adjust it, okay, what I want to do is keep pressing this. Okay. So just relax, breathe normally. Can you feel the pressure on your arm? Good. Perfect. Okay, perfect. that. Okay. I'll just release this and you can let your hand go. Okay, so if you just want to pop your arm back down. Thank you. Okay, so what I want to do now, I just want to do a smelling test, okay? These are quite common smells, so just give it a guess. Honestly, I don't mind if they're wrong. Whatever comes to your mind, just let me know, okay? Okay, so if you just want to sniff, okay? Give it a few seconds. Yeah. That's correct, well done. Just pop the lid back on. Okay, next smell. Okay, give it a few seconds. That's correct, well done. And last smell. Just give it a few seconds, hold it there. Yes, that's right. So what I want to do now is I just want to feel around your neck, okay, really lightly, just to see if there's any lumps or bumps or any swelling, okay? How's that feeling? Any pain? Just around the back and the front. That's all feeling great. You okay? Perfect. And now, if you just want to open your mouth as wide as you can, okay. I'm just going to shine the light in your mouth. I'm also going to use this little mirror here just to help me see the back of the throat. Okay. So you just want to open. Perfect. Keep your mouth open as wide as you can. And now I say ah. Keep going. Ah. Wonderful. Okay, so what I want to do is want to do the hard or fluffy test. Okay, this is just a little brush. And this has just got a blunt end. Don't worry, it's not sharp, it's just blunt. Okay, so if you can close your eyes for me, okay? And whenever you can feel something, just let me know if it's soft or hard. Very simple, okay? First one. Yeah, okay. Second one. Okay. Next one. Yes. Now, that one. Okay, now this one. Yeah. Now this one. Yeah. And next one. Yeah. This one. And this one. Perfect. You can open your eyes now. That was great. Okay. So I just want to go back on the eyes, okay? And this is more of a focus test, okay? So just want you to focus here. Great. focusing on the cat. Fantastic. It's gonna come closer. Keep focusing. So now the kitty cat is just going to move around really slow. Okay, so just keep focusing wherever it goes. Okay, and the other side for me. Just keep following it. Focus. Focus. Fantastic, okay. Now I'm going to use the same tool. You just want to keep focusing here, okay? Keep focusing. And the light is going to be behind it. Then when the light pops out, you're just going to let me know. Say yes, okay? Keep focusing on the cat. Okay. Closer. Amazing. Okay. This is another focus test with the light. Okay, so if you just want to look at this black dot here, keep focusing. Okay, now keep focusing on the black dot. Keep focusing. That's great. Okay, perfect. Whilst the pupils are already dilated, I just want to measure them, okay? So keep really still for me if you can, and just look at my nose. Well done. If you can't see my nose, just keep looking straight ahead for me, please. Okay. Perfect. I'm just going to write some notes. I just want to do one more focus test, okay? Just nothing to do with lights, just really simple object, okay? If you just look at the silver part of this pen, and if you just keep following, keep focusing on that. Great. Keep focusing on the silver part of the pen. Keep focusing on the silver part. Okay, and now, could you just tell me when this pen leaves your vision? When you can't see the pen anymore? Okay, if you just want to keep focusing on the silver part. Great, okay. Fantastic, okay. Perfect. Silver part. Okay, one more time. Just another time. Okay. Brilliant. Okay. And now what I want you to do is I want you to tell me when the pen comes into your vision. Okay? So, ready? You're doing great. Amazing. Perfect. Okay. And now, just focus on my fingers, please. And when they leave your vision, please just let me know. Okay? Just say now. Okay. Great. Yeah. Over here. Okay. Great. Closer. And further away. Side. Side. Okay, really far away. Great, okay. And when my finger moves, okay, put my hands out here. When my finger moves like this, you just point which side is moving. Perfect, okay. Great. Great. Just keep going. Great. Yeah. Fantastic, well done. So, just want you to look at this little chart here, and if you just want to tell me what the letter is below the number, okay? This one? Great, and this one? And that one? Okay, that one? And this one? And that one, please. Great, okay, but now if you just want to tell me the numbers, okay? This one? This one? Okay, this one? This one? And this one. Fantastic. Now, just want to inspect your eyes a little bit closer, okay? Okay. Alright, so if you just want to blink. Okay. Blink again. And blink again. Okay. Blink. 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 Great, blink. Keep them open for as long as you can. Don't blink. 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 Don't blink. Don't blink. Fantastic, well done. Okay, so what I'm going to do now is I'm just going to check these points that I mentioned before, just to check that there's been no swelling. Okay, so just look at me, look at my nose. Thank you. Okay. I'll just get it to where I had it before. Yeah, that's great. Okay. Stay still. Stay still, thank you. Fantastic, yeah. That's all perfectly fine. There's absolutely no movement on those dots, which is great news. How have you found that test? Yeah? Okay. Well, the overall exam went really well. All your nerves are working perfectly fine. Your blood pressure is fine. Your heartbeat is regular. Okay? Which is good news. Your pupils are dilating, and when I checked around your head, there's no swelling, there's no bumps for now. Okay. Okay. Alright, well, that was the end of the exam. Today, the green light is to go home, maybe have some rest, drink lots of water. That's what we advise after a bump on the head. And yeah, if you can, just relax, lie down. Try and stay off your screens, so maybe no TV and no phone if you can. Maybe just read a nice book. Okay, lots of rest as well. But yeah, have a great day. Take care. Bye.